The COVID-19 pandemic continues to be a rapidly changing target, with new information and changing plans every day. As president of the Congenital Heart Surgeons Society, I wanted to reach out to you, my colleagues, hoping to summarize the issues and offer some practical guidance. While the evidence clearly shows the frail, the immunosuppressed, and the elderly as being the most vulnerable, we are now learning that younger patients are also at risk. Pediatric cardiac surgery is unique, and the CHSS membership is small relative to other specialties and other organizations. In many ways, the pediatric cardiac surgical community is an extended family of friends and colleagues that have partnered together to innovate and problem-solve some of the most difficult clinical situations. To me, we have been the champions of cooperation and collaboration. Our specialty is unique because the timing of surgery for newborns, infants, and children is critical, and the window for success with surgery is often narrow. Canceling or delaying surgery is not possible in many circumstances. The safety of our patients, healthcare providers, and the community are our highest priority. The ages of our patients, their siblings, and their family members make social distancing strategies difficult, if not impossible. These issues apply to the home setting and the hospital setting. Many family members may be staying at the local Ronald McDonald House, another common setting for our specialty, where social isolation is difficult to achieve. The CHSS is being proactive to help our members deal with this crisis. We have created a listserv form that will provide our members with a place to share relevant information, best practices, policies, institutional guidelines, surgery cancellations, and space, supply, and staffing issues. It is difficult to establish guidelines since things change so quickly and may be unique depending upon program size, patient population, and geographic location. However, practical observations can be shared and include experience with the smart use of personal protective equipment, non-clinical staff working remotely, 2-week on-off teams to reduce overall exposure, adaptive clinical care models that modify or reduce on-site manpower should also be explored. When possible, reciprocal privileging amongst neighboring programs may be critical and should also be extended to non-surgical personnel such as the ICU staff. Finally, there should be a lower threshold to move critical patients to other hospitals or locations where manpower and resources are more abundant. Information on the listserv will be sent out to all members, and I encourage each of you to opt in to this unique congenital-only form exclusive for CHSS members. We are in the storm now, and harder times in this public healthcare crisis are still yet to come. One distinctive feature of our specialty is the small size of our hospital workforce, 2 to 3 surgeons for many programs. Sooner or later, one of us will be exposed or will operate on a COVID-19 patient. The probability of a colleague being exposed will be high, and at a moment's notice, a program could be shut down because the workforce is either ill or quarantined. We should strive to structure our community as several large regional teams that help one another rise to this unprecedented challenge. We know our neighbors. Get on the phone and talk, plan together, ask questions of one another, and come up with contingency plans. We are a critical public health resource. It is our responsibility to stay connected and support each other during these most challenging times. At the same time that we are developing the CHSS webpage forum for members and their colleagues, we will also be collaborating with the World Society for Pediatric and Congenital Heart Surgery and the European Congenital Heart Surgeons Association to develop a survey to distribute to colleagues around the world. We are hopeful that sharing information with colleagues facing the pandemic at different stages in diverse environments will help us to better understand some of the multiple aspects of the impact of this pandemic on the practice of congenital heart surgery. On a personal note, I am interested in your personal health and safety. Please share with our membership on the website or write me directly at jdearani@mayo.edu if you are confronted with any of these issues or need help or advice. I sincerely care about each of your well-being and this organization. Our specialty is exclusive because of its solidarity and camaraderie. Our history epitomizes flexibility, adaptation, and instant readiness. Never have those qualities been so crucial. Together we can do this. Be strong and stay safe.